Medical Student Education Series Core Orthopaedics. All about orthopedic infections, osteomyelitis and septic arthritis. Part 2. Carrying on from our previous video, you should note with chronic osteomyelitis you can get a squamous cell carcinoma in the tract from a chronic discharging sinus. Nutrition is very important in decreasing incidence of post-op infections. Post-splenectomy patients need to be protected against meningococcal infection. Here are some cases to illustrate previous principles. Chronic septic joints, chronic OM, subtalar joint, destruction on the x-ray, hot bone scan. TB of the knee, don't forget it, patient from Korea. Chronic osteomyelitis of tibia, a very physically active 40-year-old male, small discharging sinus. We don't want to undertake any major surgical extravaganza here. Curette it, remove the sequestrum. Warn it may recur. Quite a different case. Chronic osteomyelitis of the tibia, 30 years. Best we can hope for here, wash it out, debride it. Yes, you can undertake major resections of the bone, but this carries a significant morbidity and mortality that has to be explained to the patient. More hard cases have to involve the whole infectious disease team here. Syphilitic ulcer, HIV patient foot. Diabetes, major problems of vascularity of the foot, often requiring surgery, amputations, secondary infections, osteomyelitis below this discharging sinus plantar surface of the foot. Pathological fracture through an infected femur. What do we have to do? Stabilize the bone with a nail, then treat the infection. Bone scans useful for occult infections. Here the sternoclavicular joint. Another case, the nut fracture has already been nailed, then becomes infected. Keep the nail in, bone scan was hot. Deal with the infection in a stable bone situation. More long-standing cases. An old Girdleston, hip replacement, became infected, had to be removed. Get rid of the infection, debridement. Once you're happy, it's all quiescent, then you can go to another hip replacement. Major undertaking. Bone loss, worries about infection coming back. Infected elbow, young child, incompletely treated, has come back.